Hi everyone, I am Dr. Sudha. I am one of the consultant neonatologists and pediatrician in Lotus Hospitals. Today I would like to discuss some of the common illnesses that children can have in monsoon period. The first illness that I would like to discuss is about dengue. Dengue is a viral infection that is caused by mosquito bite called Aedes aegypti, which is present in the stagnant water. This is the most common illness that occurs in rainy season, especially at the end of August, September and October when rain is prevalent and water is stagnated. The symptoms that the babies or children present with dengue are high fever, body aches, headache, abdominal pain. Not all children with dengue will have complication, but some children progress on to have complications, which is called dengue hemorrhagic fever. In this, the platelets will become low and children can have bleeding problems, low blood pressure and circulatory collapse. So how do we diagnose is like any child who is presenting with high grade fever which is not remitted, we should get tested for dengue, and also platelets need to be monitored once the diagnosis is confirmed. Dengue is, as I said earlier, dengue is a viral infection which is can be treated with supportive care and IV fluids. However, when the platelets are dropping down, or if the child is not feeling well or is not hydrating properly, some of these children will need hospitalization and doctor supervision, including IV fluids. The next illness that I would like to talk about is malaria. Malaria is caused by bite of a group of mosquitoes which are present on dirty water. So malaria is again a mosquito borne illness. The children in this will present with fever, body pains and abdominal pain. If malaria is not treated at the right time, they can have complications such as jaundice or anemia, or sometimes they can go on to have liver or renal problems. Malaria can be treated with anti-malarial medication. However, before we give any anti-malarial medication, the diagnosis should be confirmed and should be given under the supervision of the doctors. The next illness that I would like to talk, which is also very common in rainy season, is typhoid. Typhoid is a bacterial infection which is caused by bacteria called Salmonella typhi. So this infection occurs mainly by children drinking food or drinking water or eating food which is contaminated with the feces of the infected person. So here the children will present with abdominal pain, they can have fever, they can have vomiting or loose stools. Typhoid can cause dehydration also, and they can present with high grade fevers. Treatment is by giving IV antibiotics. So if your child is having any of these symptoms, they should visit the pediatrician and get the necessary treatment. The next few illnesses are more of viral in nature, which I would like to discuss. The first one is gastroenteritis, which is caused. The next illness that I would like to discuss about is gastroenteritis. Gastroenteritis and food poisoning occur in rainy season, especially when children eat outside food. The symptoms of gastroenteritis are again vomiting, motions, or they can present with high grade fever. With continuing vomiting and motions, children can have dehydration and might need IV fluids. Treatment of gastroenteritis on most occasions is supportive treatment with IV fluids. Antibiotics are not needed on most occasions. However, if there is some superadded bacterial infection, they might need antibiotics. The next illness that I would like to talk about is influenza. Influenza is a viral infection which is caused by exposure to infected droplets. It is highly contagious and can spread from one person to another person through coughing or sneezing. So the children here present with runny nose, cold, cough and can have low grade fevers. So influenza is a viral infection and antibiotics are not needed. Nowadays there is with this COVID pandemic, the pediatricians are recommending influenza vaccine to the children, as there is anticipation that the third wave will happen. So this influenza is a seasonal illness, and the vaccine can be given in the month of August up to 5 years of age. So this year we have been recommending for children to get influenza vaccination, as studies have shown that there might be some cross protection to COVID. The next illness that I would like to discuss about is viral fevers, which is the most common infections that the children face it. Viral fevers occur because due to sudden change in weather and humidity, infections occur. Here children present with fever, body aches, myalgia, they can have low grade fever. Viral fevers can last from 3 to 7 days, and it is as from the word itself, viral is does not respond to antibiotics, and on most occasions antibiotics are not needed. Treatment for viral infections is supportive, and hydration and adequate bed rest is needed. So in conclusion, like all these infections that I have discussed, we can prevent it by doing some simple measures such as taking a balanced and food and healthy diet, and also nowadays with COVID pandemic, a lot of children are receiving junk food, so try to avoid junk food and have a balanced diet. And also children should be encouraged at home to drink plenty of water. In this way, like having a balanced diet and having plenty of fluids will help them to avoid infections, and try to avoid junk food or outside food to prevent these infections. Thank you.
Lotus Hospitals is one of the leading brands for all your health needs. You can visit our expert doctors at any of the centers: Lakdi, Kukatpally, Nagar and Vizag. For booking an appointment, you can use our app or visit www.lotushospitals.in or call on 040 4040 4444.